This video reviews TMJ imaging. We'll look at both the exam and how to use the VolumeRad equipment on the GE room. Yes, that's a real tomogram of an apple and then an avocado. TMJ imaging is most commonly done to rule out things like TMJ disorder. We do both a closed and open mouth view, and the reason we do that is to see how the joint is working. Patients sometimes have their TMJ slip out of joint, even with the simplest of tasks like talking, eating, or just opening their mouth. So that's really what we're evaluating here. Traditionally, these exams were done with both a left and a right lateral in both the closed and open views. But thanks to modern technology and programs like VolumeRad on our GE equipment, we're actually able to just do one sweep with the mouth closed and one sweep with the mouth open, and that will get us both the left and right views. If you want more details on TMJ disorder and how it affects our patients, check out Mayo Clinic's website. They have a pretty cool article on it. For our exam, we would begin with pulling up the TMJ Tomo option for our VolumeRad exam. You'll use the TMJ lateral option to take a scout film. You'll position your patient in a left lateral for this scout. Now, if a patient can't tolerate that, it's totally fine to do a right lateral. Just remember that later on in the exam when you're doing the processing of your images. So here I'm just using the auto position function to position the x-ray tube for my lateral to take that scout film. By the way, if you want a step-by-step, very clear instruction, Jane worked on a cheat sheet, shout out to Jane, that is just step-by-step as you go through this process. So that is really helpful in the moment. This video will help you with rolling it all together and seeing what it looks like in almost real life as we image the skull. So here, I've positioned my patient just center directly on the TMJ. You can actually collimate down to almost a 4x4 on here, which really sharpens the image. So we've positioned our patient for this scout film. We're going to walk back behind the panel and make the exposure. Now this is the part when you see your anatomy on there in the center of the image, you know you are golden for your Tomo sweeps. So instruct your patient to not move. That's a very big part of it. Also, in real life, instruct your patient that the tube is about to move over them and will make an actual sweep. That's a really big part of not scaring our patients here. So I've just tilted the tube back in the start position for the Tomo and then hold down the exposure button to complete a full sweep over the patient. Now, really important information is it is actually imaging all the way from the tabletop up until the tube. So it's gathering all types of data right here, which is why it seems a little bit slower in processing and pulling up these slices. A really great way to remember the millimeters that will appear on each image in a few minutes is that the tabletop actually starts at 0 millimeters and it gets higher the further we get from the table. So if you're imaging left side down, your left TMJs will have the lower numbers and your right TMJ will have the higher numbers. So really kind of a nice little cheat for you to keep in your mind. Just that 0 millimeters starts at the very tabletop. So we're flipping through our images here. By the way, it has a great feature with this updated version that you can use your scroll on your mouse to actually flip through these images. In the lower portion of this gray area, you see this circle with 2 arrows pointing towards it. That's actually how you reset from your scout film if we didn't like it and wanted to take a new sweep. This is the point in the exam where you would prepare for the open mouth images with a scout film and full Tomo sweep. After you've completed that imaging, as long as your anatomy is on the images, you can let your patient go because all of the data is stored in the computer for reprocessing. Our next step is to use the quality control tags option to select just the images that will go to PACS. Using the image review tab that looks like a Polaroid picture in the upper left-hand corner, you'll go through the series of images like you see here. Looking at the processed images, you'll pick out the ones you want to send to PACS. And then over to the left, you hit the edit button that looks like a pencil, and this is where we'll place our quality control tags. This is how we select what goes to PACS. So this is the point, if you were doing it in real life, I would definitely use that cheat sheet that Jane made, because it is a bullet point style, step-by-step sheet that takes you through how to do this. I'm going to show you as you get to see it on the screen to kind of prepare your mind why we're doing it. So we're marking these quality control tags so that we only have a select few of these images ready to go to PACS. And the reason we're breaking it up into sections is because we want our images to display like a true left lateral for the left side and a true right lateral for the right side. Instead of just sending them all in one group, which would be a little bit confusing for the radiologist, we're actually going to display the left like a left and the right like a right. The cheat sheet also walks you through how to place a marker, and we suggest that you use the Custom tab for this section. You might ask yourself though, what happens if you don't have both joints on your images? Maybe you did a left lateral and you see the side down just fine, but the right side isn't included with your pictures. Well, that doesn't mean that you have to re-image the patient or make another exposure. The great thing is that you can come in here to this little kidney bean icon and select image processing. All the data is stored there for us, and we can simply change the parameters so that it is included in kind of a reconstruction, similar to how a CT works. Now, from personal experience, I can tell you most of the time your images come out beautifully and you don't have to reprocess. But it's nice to know how, just in case. If you had done an image with the left side down and you don't have the right side on your images in your series, you would adjust the slice height section. So your starting point is 2 millimeters. That's the top of your table. And that 146 millimeters that you see there, that is the furthest away from the table. So we could just slide that yellow bar down to the endpoint, open that field up basically. We'll also have to include the look section here with the drop down. I usually just pick the one with the asterisks because that is the one that works best, and then reprocess your images. Now, when you do this, it will give you an entirely new series. So you will have this whole new set of images that include both the left and right side, and you'll go in and do the rest of the exam like normal. You'll place left and right markers on there using that custom section and your quality control tags. So once you've done that, you will have to go in and flip your images for the right side to appear like right lateral images. We mentioned this earlier in the video, and this is the part I really encourage you to find your own groove on and what works for you. So if it works for you to go in and reprocess, flip the images, and adjust the quality control tags before you close your study, great, roll with that. The other option is that you can close the study and come back into your completed exams, adjust your images, and then push that second set of annotated images that look like a right side to PACS. Now, this is included in Jane's cheat sheet, so again, I just encourage you to find what works best for you. The end goal is to have one set of images in PACS that look like a left closed, a left open, a right closed, and a right open. I'm also the very proud owner of a plastic skull that I purchased on Amazon.com. It is super helpful for these images. It's what I used for these test images, and if you just want to practice in a no pressure situation with no patient, it's great for that. So if that sounds like a good idea, let me know. We can do it together. You could have the skull for the weekend, practice overnights, whatever works for you. Kind of take the pressure off and just play with the equipment and play with the processing of the images, and you'll feel comfortable in no time.